Hi, it's Doug from Rise Above Performance Training. Today I'm going to go with 5 exercises that can help with low back pain. It's estimated about 80% of Americans will experience some type of low back pain in their lifetime, so it's a very chronic problem and we want to try to address it. Now the exercises I'm going to show are just to help muscles that are tight. These aren't to address bulging discs or any type of arthritic condition in the spine. If you have chronic back pain with shooting nerve pain, please go see a doctor. These are just for people that have tight hips and just dull back pain from everyday life or sports. So the first thing we're going to do is we got to mobilize the hips with a pelvic tilt. So there's this thing called anterior pelvic tilt where the hip flexors can be tight whether you sit, muscle shortened here, playing sports all the time. What it does is going to rotate the top of the pelvis forward and the butt's going to shoot back, so you're going to walk around kind of like this, a duck back. Extends the curve a little bit here. It tightens these muscles up and then tightens the low back muscles. So what we're going to try to do is we're going to try to mobilize them, get our hips underneath us a little bit, and just relax these hip flexor muscles. So a pelvic tilt is basically just doing that motion both directions. So I'm going to start neutral, so I'm always going to try to get my hips underneath me. This is in my neutral stance. So for a pelvic tilt, I'm going to go posterior pelvic tilt by pulling my belly button in and getting the bottoms of my hips to curl up, and then I'm going to rotate the other way. Ideally, you want to be in isolation of the hips. This might not happen at first. You might have some drifting of the upper body, but ideally we want to try to just isolate from the hips. From the front, we're going to do it here. My feet are about shoulder width apart, and I'm not pushing into pain. So when I go posterior, I feel right about there. I'm tight. I'm not going to push past it. I'm going to tuck underneath me and push back. So I would start with the standing one first. You can do these at your desk at work, and you just get up and do a couple just to loosen up if you've been sitting for a long time. The second way you can do it is in a kneeling position. They call this a cat-cow. So I'm going to be kneeling, all fours. I'm going to try to be over my wrist, shoulders down, neutral position. And I'm basically going to do the same thing. I'm going to pull my belly button up. And then I'm going to rotate the pelvis back. Going right to where I feel a stretch, not overdoing it. Ideally, I'm trying to keep my body level so there's no shifting around too much or sinking. And I just want to loosen things up and get it activated. You can also do this supported on the ground. Feet about shoulder width apart. I'm going to draw my belly button into the mat, flattening out my back, and then I'm going to rotate top of my hips down, trying to get the hips to be mobile. So this is a good warm-up exercise to get the hips loose. Again, to battle sitting for too long. Try that one out and we'll move on to the next one. Okay, back exercise number 2. So now we're going to do a little bit of mobilization with strengthening. I give this a lot to my athletes just to get the glutes to fire. So again, if we have that anterior pelvic tilt position, our glutes are going to be turned off just because of the position they're in. They're not going to help our body extend and getting our hips forward. So a simple bridge will help activate those glute muscles and get your posture aligned a little bit better in those hips. So simple bridge, I'm going to be feet about shoulder width apart. You can turn your toes out. I'd say the foot is about maybe a shoe to 1.5 shoe lengths away from your butt. You're going to pull the belly button down, get that neutral hip. So we talked about standing up. We don't want to be too flexed forward in anterior pelvic tilt, posterior pelvic tilt either. So we want to be right underneath us. So I'm going to pull my belly button down, get my hips underneath me. I'm going to squeeze my butt, push through mostly with my heels, and I keep squeezing until my hips extend. Ideally, I want to be flat at the top, so if you're only getting here for right now, that's okay, but I want to keep going by squeezing. I'm not pushing up, I'm squeezing my butt, and then I want to be stable. So I don't want to drop a hip, I want to be up. Usually with the 2-footed bridge, you won't drop a hip too much, I'm going to come down. I like to relax completely in between, at least for a half second, to unlock those muscles, and I'll do repetitions. Go until you feel loose. The second one you can do when you get pretty good at that is a single leg version. So I'm going to be on one leg. I like to straighten my other leg so my thighs are parallel here. And again, I'm going to squeeze nice and slow, extend through the hips, try to get as flat as I can. Again, I'm trying not to drop here. I want to be level. So if there's a pull going through, right through my hips, they're nice and straight. I control down, I relax in between, and repeat. When you get pretty good at that, you can do a figure 4 by crossing the ankle over the knee, and you want to try to pull this down and get it flat. This one, the hips will shift around a lot more, so you got to focus on this one a lot. So again, I'm going to extend, and this is going to add a little added bonus by opening up the hip and the hip flexors and the groin muscles, and I try to flatten out at the top. Control down and relax. As I'm bridging up with my hip, I'm pulling down with the knee and trying to open everything up and flatten. You may find one side to be a little bit higher than the other or less flexible, so it's just something that you have to work on. So try those floor hip bridges, and then move on to the third one. Okay, leg rotation is very important for a healthy back. What I mean by that is the ability to move the leg in and out without turning the hips. So just internally rotating and externally rotating within the socket itself. You'll find maybe one leg is really good at going out and not so good at going in, and the other leg might be the opposite. If you're playing a sport that's one-sided or a stagger stance like golf or tennis, that's usually the case. So we want to try to open it up, because if you don't, that'll cause the hips to be misaligned by pulling in one direction and just throwing them off. So we try to balance out the best we can. A good way to start this is to have a supported step. You can have one higher or lower than this. I'm going to get my hips underneath me, and I'm just going to rotate. I'm going to drop down, and I'm going to rotate back this way. Now when I rotate, I'm not turning my hips or opening them up. I'm trying to keep them square and just kind of being honest with myself where they go. This is as far as I can go with this leg. And I can drop in this way. So I just want to think about the socket up here, flossing within that joint and loosening it up. So that's the easiest way to do it, is with the support. Another way you can do it is on the floor. You do a basic hip drop. So I'll get off the mat here. So I like to start with my feet down, just so I know where I need to be. Sometimes when you start sitting up and you put your legs down, they won't go. So I'm kind of in a 90-90 here with my knees bent. I want to sit up tall. I'm going to shift a little bit this way. And then what I'm going to do is I'm going to rotate them here and then drop them to the other side. So I'm just dropping them. My hip will go forward a little bit. You can pull it back when you're at the end here. We just want to get those hips to drop. They might not drop all the way. This one's popping up a little bit, so that's something I'll keep note of. I'll see if it does it on this side. Now this side drops a little lower, but I'm a little tighter in here. So my left leg needs a little bit of work, and I'll just work on that. A little bit more aggressive one is you can do a frog position, which is basically you're going to bring your feet in close together in the back. I'm going to bring my knees out. Been working on this one. And I want a nice flat back. So you can have your hands here. You can have them down if you're a little bit more flexible. You can kind of flatten your legs out. I'm going to keep my hands up here because I'm not. I've been working on this. I'm going to turn my feet down, my heels down, so toes are out. And what I'm going to do is I'm simply going to rotate my foot out. So I have the support of the knee on the mat. And this one I go real slow because I can feel a lot of things burning. So I want to try to keep as stable as I can so I'm not dropping to get extra range of motion. I'm keeping it down nice and stable and going as far as I comfortably can. So this one's basically the progressions are endless. I can bring my foot in more and do it, and that's a lot harder. As I get better, I can flatten out more and do it. And we talked about being on the arms, so I'll flatten your body out more. And then again, I gotta do both sides. Now this side is not as good for me, so I'm gonna stop right where I feel a wall and then come back, and then hopefully if I do about 5 to 10, I'll be a little bit looser for the day there. Lastly, you can do them standing as well. I've been working on these as well. You're going to lift your hip up, and you can do this with support. So I started off with a beam, holding on one of my racks, and now I've been working on going slow and trying not to use a beam so I keep my balance. So my balance is improved along with my mobility a little bit, and I'm going to rotate it out, kind of like the frog, and then I like to stretch it out too to see if I can keep my balance, and then down. I'm hitching a little bit. As I work with these, I'm going to start to not hitch as much and then keep them parallel to the floor. So I have a little bit of a knee drop because my groin's tight. So as I go along, my goal for myself is when I'm here is to keep it a little bit higher. So that's another one you can do, start supported, and you can do it standing. So that's it for the next one, and then we'll move on to the next block. The next exercise variations we're going to do is a squat. So I don't know anybody that has a bad back that can do a great squat, but then again, I know a lot of people that have bad backs or tight backs and they can't do a squat at all. So we're going to go over the squat, how to do it, but we're going to take it from a position of rest versus a position like an exercise with a barbell on your back or goblet squat in the front. So we want to really open up the hips and be able to sit into it and relax there. And you'll find all your muscles of the low back and everything just kind of release. The first way to do it is supported. Whether you use a TRX, suspension straps, or just a rack post, we're going to sit into the squat. Now, squat can be about shoulder width apart. I like to turn my toes out a little bit and kind of open up the hips, and I'm just going to support myself. Whether I walk down, if this is as far as I can get, I want to get here. Now, again, think about relaxing. I don't want to be here and be tense. I want to try to relax into it, even too much tension on the arm. So I'm just going to try to sit here and relax as much as I can and see if I can stay there, elongate my spine so I'm dropping my hips, pulling my chest up, and seeing if I can just kind of relax in this position here. So that'll be your first phase. Now, if you're in here for a long time and you come up, the support's great to help you get back up because you might not be able to get back up too easily. You can even rock forward and get back up a whole lot easier. After you're pretty good with the supported one, it's time to take the support away and just squat. Now, ankle flexibility is going to be huge. If you don't have good ankle flexibility, what's going to happen, you're going to pop up on your toes to get into that full squat. So it's going to be something like this, like a catcher in baseball. Not a bad thing, but it's still not a resting position. So you want to use that support to kind of stay in here. So once you can kind of get into a squat here, staying down, keeping the ankles down, you can get more ankle mobility just by shifting. I like to start with circles, and I'm just rocking back, rotating around, rocking back, and I'm just testing my flexibility a little bit, but I'm maintaining contact with the floor as long as I can. You can go both directions. You might be able to shift more to one direction and keep contact than you can in the other direction. I'm using my feet to push out, push out. You can rock back and forth a little bit, so you're getting that glide of the ankle. I'll stop and relax. You can push out, but try to get your body relaxed and sit here. Lastly, we did those rotations, like those frog rotations. You can do those when you're in the squat position. So I'm in the squat position, I'm relaxed. I'm gonna rotate here. These are a little more advanced. Try to open up the hip. When I come back, I usually have more rotation and more flexibility. So I'm rotating, trying to go slow, maintain that body position. After I do one on each side, I usually try to sink back into it, readjust, rotate again. And rotate again. So I'm getting tired, my feet are getting wide, I'm going to pull them in, relax, and just stand right out of it. So we have one more to do, get to it. Like any injury, it's important to look above and below the chain. So all the exercises I gave you for the low back pain, we focused along the hips, inside and outside, but we also have to look above it. A lot of lat tightness, So the lats are the muscles that run in here. Computers, driving, sports, pulls our body forward and pulls on that back. So it's important that we open everything up to elongate things and let these low back muscles relax, get our pelvis underneath us. One way you can do this is a simple hang. Now, if your grip strength's bad or you're just not quite ready for it, do a supported hang. So I'm just gonna get a neutral grip. And what I mean by neutral is just straight up. So wherever I feel comfortable, if I need to go a little wider so I can straighten my arms, that's okay. So we don't want to be too bent or scrunched up in here. So I'm going to grab, and then I have this box here for support. So I'm only going to hold as much weight as I can comfortably tolerate, but I got to relax. I can't be tense or else I'm not going to get the benefit. So I'm going to relax, and I'm using this box for support. And just kind of hang. You might get a few pops in the upper thoracic. You should feel your lats release a little bit. Just hang. So obviously when you get better at that one, you can take it to the next level and just take the box away. So I'll be here, stabilize myself, and I'm going to sink. If you want, you can kind of contract a little bit and relax. It's very similar to the squats where we're rotating around. You can kind of push out a little bit. You can be a little more advanced and rotate. Just trying to open things up all the time. Every time I do a movement, I try to relax in between and see if I can get a little bit more length out of that lat. Another one we can do is a side trunk bend. So I like support with this one. I'm going to put my hand here, and I'm probably going to start in this rotated position. I want to open up here and get this long line that travels straight down my body. So I don't want to have my elbow not aligned with the rest of my body. Now I might have to grab in different spots. If I grab lower, I'm going to be more rotated. So I'm going to find a spot where I can grab comfortably and keep that position. My head's neutral. I like to push on the bar, and I'm thinking about making space in here. So I'm opening up that lat, making space. You can contract a little bit and relax. It's kicking the hip out a little bit. I can rotate a little bit, get a little bit more extra stretch in that lat. So you do both sides with that and try to make space in there, get long, and hopefully that'll take pressure off that low back. So there you have it. Try those 5 exercises, add them into your program, and see how your back feels after that.